guys, it's Shay. Welcome back to the channel where we talk about beauty, nursing, and lifestyle weekly. Today I'm going to be bringing you guys a nursing video. Many of the students on my channel as well as the graduates are starting clinicals this semester, and what better way to have some advice on how to succeed in clinical. I've been a nurse for 3 years and I just started as an MP student, so I've been on both spectrums of clinical format, being both the preceptor as well as the preceptee. So I have a few tips here to keep you successful and almost help you land a job at the end of your clinical. Make sure you stay tuned so we can get into this video. Okay guys, so the first thing I always tell people when entering a clinical setting, whether you are a nursing student, a nurse practitioner student, a medical student, you treat your clinicals like a mini interview. So act like all eyes are on you for how many ever weeks you are in this clinical setting, because this will ultimately determine how people view you. And like I said, it's a mini interview. I remember during my undergrad time, I actually got offered a position after my clinical. I did not take it because it wasn't in the specialty that I wanted it in, but it really proved to me that if you prepare yourself and set yourself up for success during clinical, it will really benefit you in the long run. So the first tip I have for you guys is make sure you come prepared. There is nothing that looks more tacky, and yeah, I said tacky, than coming to clinical without items you need. So if you need a stethoscope, bring it. If you need a blood pressure cuff, bring it. If you need bandage scissors, bring it. Of course, we don't expect students to have every ache and cranny with them at all times in all places, but I've seen people forget their stethoscopes. I don't know how you forget your stethoscope for clinical, but just don't do it. You know you need it. You know it's an important piece of your clinical actions, so don't forget to come prepared to clinical. Bring pens, bring pencils, do all that fun stuff, but make sure you come prepared. The second thing I'm going to bring up is make sure to take notes. You want to take notes on two types of things, which almost feels like everything. Things people tell you they don't see often, and things people tell you they see all the time. So I remember back as an undergrad, we were learning about congestive heart failure, and I remember we were assessing patients in clinical, and my clinical preceptor was like, oh, every time I have a CHF patient, this is usually what their labs look like, this is usually how they present, this is usually what the doctor is going to order. You don't want the doctor to order this if they have this other chronic condition. This is all things that I took notes on. And then I remember one time during like a peds rotation, even recently when I was in clinical for nurse practitioner, we had seen a rash in clinical setting, and my nurse practitioner was like, I never see this. And I was like, you know what? That means let me take note, because especially when you hear people don't see things often, it means it's not diagnosed often. So if you're able to pick up on something because you've seen it before and you took notes on it before, it will definitely benefit you in the long run for your success. Now I know it's hard in clinical. You have scrubs, you have tons of things in your pocket. You're like, where do I keep these notes? Do I get a random piece of paper? Do I get a paper towel? Recently for my clinical, I have picked up these index cards. And I'm actually just gonna slip my information out the front so I can show you guys. But this was only $1 in Dollar Tree. It has tabs, so I'm able to keep tabs according to what clinical I'm in, and I'm able to just add information into the index cards that I can use to later, you know, not only help me in future clinicals, because I'll take this throughout my whole process, but even like when you're studying for tests or you know you've seen something before, you can just pull this out your bag and simply look at small notes. So like, I don't know if I have anything in here. Yeah, like I have some labs in the front. Like I have my thyroid labs here. We see hypothyroid a lot in primary care, so I have that written down. I also have some like cholesterol levels written down, and then I also wrote like for example, some drugs that my preceptor told me that she usually recommends for anxiety that are non-benzos. I wrote those down because these are what are important for me in primary care. Again, I know I have a variety of students on this channel. If you're going to be working in acute care, take notes on stuff that's in acute care. If you're going to be working in peds, take notes that apply to peds. If you're going to be working in OB, y'all get it. Y'all get it. Y'all don't need me to repeat it, but just make sure you're taking good notes and stuff that you can take with you into the future, into your practice. Okay guys, so my third tip is coming a little bit from me having students as well as someone who was a student. Don't be afraid to jump in when there's an opportunity to do procedures. I know sometimes when you go to clinical, there's times you go to clinical and you're by yourself, and there's times you go to clinical and there are a bunch of students. Be that student who is willing to try whatever. Try whatever you can while you're a student, because it will prepare you for when you get to your own practice. I'll never forget back in my undergrad nursing, we had a Foley, and I remember so many people were so scared to try this Foley. And the preceptor always looks for the student who's ready to do stuff. Like, you ready to do this? Let's do this, because it shows that they're like passionate and that they're driven and they're ready to go. Like, let's get it done. And also, it just, like I said, I rather do something as a student and like my patient knows I'm a student, my preceptor knows I'm a student, they talk me through it, versus you get on the floor and then you have something and you're a brand new nurse, or you've been a nurse for years and you just never seen it before, and you're like, oh crap, I have to try to do this and I've never done it before. Now don't get me wrong, there's a lot of things I've done on the floor that I haven't done before. It's not a fear. You go grab a buddy. Anytime you haven't done something before, grab a buddy. It doesn't look stupid, it doesn't look shameful, but overall, whatever you can do while you're a student, do it, because it will make your practice, like I said, a lot easier and a lot better when you become a nurse on your own. Okay guys, the next thing I'm going to speak on is just being willing to learn and humbleness. As a student, you get a lot of textbook way of doing things, and unfortunately in the real world, I will tell you guys right now, we don't always do things in practice the way the textbook tells us to do. Now, we do always keep our patients safe, and we always make sure that it is not a harm to our patient, but things are always done in accordance to how it goes with the groove of the environment you're in. So for instance, I guess since we're talking about Foleys, you see a Foley placed one way and it's different from the way you learn in the textbook. I'm not telling you to, you know, dim yourself down or appear unknowledgeable. You can ask questions, but just be like, it's not like I'll never forget this one student like approached my coworker and she's like, oh, that's not how we learned it, and I know what I'm doing because I've been a CNA for so and so years. And we were just like, whoa. And my friend went to the teacher and she said, I'm not taking that student back because I don't appreciate how they, you know, the vibes were off. So even if you see something like that, it's easy to just approach the preceptor privately and say, hey, I know real world is different from textbook. I just want to clarify, you did it this way. Tell me how this is more beneficial to the patient, or tell me necessarily why you did it this way compared to what I learned. Is it easier? Is it less painful for the patient? Is it overall a good practice? Does evidence-based practice support that better than what my textbook is telling me? There is ways you can go about asking questions where you're not appearing to attack someone, but you're still showing that you're eager and willing to learn. Okay guys, and the last thing I want to touch on about being successful in clinical is, while it is a time for you to learn, throughout your clinical, in some way, shape, or form, you should be, and I say this with caution because I don't appreciate like when people take advantage of students, but you should in some way be an asset to your preceptor. So it doesn't have to be like your first day, but you have to be willing to know that you're working with someone who does this on a daily basis, so you're tuning into their routine. So what can I do not only where I'm learning, but I'm also a asset to your routine? I always approach this tip with caution, because one thing I do not like is when you are, say you're a CNA and you're going to school to be a nurse, and then the nurse that is precepting you finds out you're a CNA, so all they want you to do is do CNA tasks throughout the day. Sometimes what I usually recommend people do, you have a clinical preceptor and then you have someone who's overseeing the whole clinical. Make sure you approach the person who oversees the whole clinical so you can just make that known to them, like, hey, I'm in school to be a nurse. I don't mind doing these tasks, but I feel like I'm not learning anything that is LPN or RN oriented. Same thing with nurse practitioner students, medical students. I'm learning things that are nurse practitioner driven or PA driven, but they are trying to not necessarily have me. They are asking me to follow up a lot of other tasks that are within my scope of practice, but right now my scope of practice is a student, and I need to learn things that are pertinent to the student. So you can talk to your overseer of your clinical about situations like that, but overall, you should be an asset to your preceptor, especially getting close to the end of your semester. I'm not saying you should be doing things on your own without overseeing, and I'm not saying you need to, you know, take charge of their assignment or anything like that, but it's just simple things like, charting together. Oh, I know this is how we see patients, so I'm gonna go in and get this patient started, and then you can follow up if that's okay with you, things like that. Okay guys, so overall we have discussed 5 tips in order for you to be successful in clinical, and also to boost up your chances of actually being offered an interview at the end of your clinical. Now, I'm not promising that you will always be offered an interview, and I'm certainly not saying that it won't come later down the road. Sometimes it might be your first semester of clinical and they know you're not done yet, but they will keep you in mind. It's also very important during your clinical setting to network. I tell people this all the time. Get to know your nurses, get to know who their manager is, get to know everybody, and establish a good rapport, because once you graduate, keeping that network will help you get a job. And that's very important. So overall, guys, I want to thank you so much for tuning into my channel. If you are new here, make sure you subscribe so you can see more videos like this. And if you're back, of course, you guys know I appreciate you so much for the support as always. If there's any other nursing related videos you would like to see, or anything under the beauty and lifestyle tiers that I also accommodate, please let me know in the comment box so I can make sure I get this content out for you guys. I will see you in my next upload, and thanks so much.